If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, can you get rid of type 1 diabetes? Answer by Wayne Bodolick. Not at this time, except by dying. T1, type 1 diabetes mellitus, is an autoimmune disease. It is caused by one, or more, of several genetic anomalies that result in the impairment of the immune system. Most of the anomalies identified so far, but not all, are located in the HLA, HUM, and leukocyte antigen complex of our genetic code. This gene family is the MHC, major histocompatibility complex, in humans, involving over 200 genes on chromosome 6. This complex is the source of all of the coding for the immune system's functions. In T1, the anomaly results in a rogue T-cell attack on the endocrine beta cells of the pancreas, the cells that produce the hormones insulin and amylin. T-cells are the lymphocytes, white blood cells, that destroy virus-infected cells, and tumor cells. There are several types of these, but the one at issue is the Treg cell, or regulatory T cells. Their job is to prevent attacks on self. They're supposed to prevent the killer T cells, et al., from attacking our own tissue, that's not affected by virus or tumor. But in T1, that function fails, and after an exposure to one of several, so far identified, viruses, called triggers, the patient with the genetic markers for T1 is susceptible to developing the disease. Because the killer T cells don't stop when the disease is gone, they continue attacking, but now attack those endocrine beta cells of the pancreas, and the patient loses the ability to produce the hormones insulin and amylin. We can live without amylin, but not without insulin. So without these cells we must inject insulin to live. Most of the research going on nowadays is to improve on the gadgets we use to deliver that insulin so that it gets delivered less imposingly, and more accurately. But there is some research going on to try to actually cure the disease. A cure would involve two primary things: regrow/replace the endocrine beta cells, and stop the autoimmune attack on those cells. The attack on those cells resumes whenever new cells are introduced, which is why no transplant has worked to date, even with heavy immunosuppressant drugs. All transplants so far have had a limited effective time frame. Of course, the work to find a way to deal with that is outgoing, and may someday be fruitful. But we're not there yet. And BTW, the most promising transplants in this regard are of the beta cells themselves, not an entire pancreas. T1's pancreases are generally 98% fine. The endocrine beta cells are only about 2% of the total organ, so there's no need to replace the whole organ. To date, no one has been cured of T1, though there are many folks living with transplants and not having to inject insulin daily. But they're all under even more imposing supervision as part of trials of those treatments. Answer by Thomas K. Reed. Studies have claimed that genes and environmental factors lead to type 1 diabetes. This ailment occurs when the immune system attacks and starts destroying the insulin-producing beta cells of the pancreas. So, those suffering from type 1 diabetes cannot make or use insulin. Such patients are recommended with insulin injections or amylinomimetic drugs or Januvia generic tablets. Type 1 diabetes cannot be cured, it can only be controlled. There are various ways to do that, like making a few changes in your lifestyle: quit alcohol and cigarettes, lose weight, avoid stress, exercise, eat healthy, don't skip on your medication, etc. You may have read stories of a couple of people who claim to have got cured from type 1 diabetes. However, doctors believe that some patients undergo a honeymoon period in which the body shows no signs of type 1 diabetes at all. However, after a year or so, signs of type 1 diabetes reappear. Answer by Aaron Moya. Getting rid of type 1 diabetes is not quite possible. As a matter of fact, type 1 diabetes is an autoimmune disorder, which means that your immune system has been reprogrammed to kill the healthy cells. It's not as scary as it seems. I just gave a very graphical answer, But well, it's not likely that your type 1 diabetes will fix itself. But there are certain trials going on right now to create bionic pancreas that could replace your current pancreas to help cure diabetes. Similarly, there are other devices and technologies that may help cure diabetes in the future. To understand and learn about such technologies, check out Abudo. They are giving out free course on type 1 diabetes. The first 500 accounts are free for a year. Grab yours now.